In order to improve your healing capacity, your adaptive capabilities, all we need to do, and we all need to do that because we're all under chronic stress. Actually, if you will do we have a test for stress. If you do the test for chronic stress, I can guarantee you 90% of our audience will find yourself in the condition of chronic stress. All you need to do is suppress the sympathetic response, increase the parasympathetic, right? Suppress your fight or flight, increase your rest and digest. Easy to say, not so easy to do. Because parasympathetic system is difficult to reach. And it's so suppressed that normal ways of dealing with chronic stress, as you know, meditation and aromatherapy and even massage and even other ways of dealing with stresses and consequences of stresses in our body are not strong enough to kick the parasympathetic into even working. It's suppressed so badly that you need to really kick it in. And basically the only one way we found it is to kick it in or jumpstart it with the scanner. And in our situation with the DAB, not even Cosmotic, the scanner. Cosmotic is too soft. At some points it can do it and sometimes it can't do it. But the scanner is a really kick on the system. So guys, these simple techniques that I put in for you, in which we will try right now, are there for all of us, regardless of if you feel sick or you don't. Because chronic stress sneaks up on you. Fight or flight sneaks up on you. You don't even know it's there. All of a sudden you start checking, you do checking, like, how are my shoulders? And you find that they're tight. And you will find that there are many mind chatter going on in your head about the worries and the problems and everything else that is happening in your life. While you're sitting here, there is other things. You will find that you're in the stress right now. And what you need to do in get you out that stressful condition is to kick your parasympathetic and let it. Basically, that's the main part. Well, there will be other parts which can calm down your fight or flight. But the main part is to let the parasympathetic work, because it's so suppressed, it needs to be kicked in. So, this is really, really simple technique that you guys will do right now on yourself. But before we do that, I want you to do the quick self-check. Okay, so just on a piece of paper, your stress level on a scale from 0 to 10, how you think your stress level is at the moment. How is your fears? Well, overall, just kind of your fears. Clarity of thoughts, concentration at the moment. Positivity level, creativity level, energy level. Right now. So seven things. Stress, fear, or pain, discomfort, forgot. Well, any pain, basically, if you feel pains in your body or discomfort in your body, and level of it, on scale from 0 to 10. 0 being nothing, 10 being the worst. Oh, basically, if you have positivity, creativity, energy will be just like 0, no energy, and 10 is great energy. Okay, done that, right? Quick self-assessment. Now, you guys, you can do it on yourself or you can do it on each other. It actually doesn't matter in this situation. So what we're gonna do? We're gonna put the dove on 3. Turn it on first of all, and put it on 3 places in the body. Just 3 points in the body, which is real fast. First points are right over here, on the right and on the left. Why here? Because this is the point where vagus nerve comes fairly close to the surface, And as you know, your vagus nerve is the main parasympathetic nerve. You need to kick in parasympathetic, so you stimulate the vagus nerve. The problem is you cannot access vagus nerve anywhere else in the body. There are only two places where you can get fairly close to it, and that's on the neck, where the vagus nerve goes behind your carotid artery. So where you feel the pulse, you get the places on the neck where you feel pulse, and you put dove right on it, on the right and on the left. So on one side, then on the other side. So these are 2 points that you're doing. You want to kick the dove pretty high, so it's still, you can still tolerate it, but the higher you can actually boost it, the faster the result will be. So you are getting it to the level of comfort or discomfort.
So this one right here, this way?
Oh, you can do that in any way. Anyway. Yeah, you can, if you have, guys, sliders or EXs, Modifix, you can do that too, because it has a scanner component in it. So you can easily use it as well. So on one side, on the other side. And as minimum, let it dose. As minimum. You can keep it longer, but as minimum, let it dose. If you're using the EXs, the sliders, Modifix, just don't even worry about any settings. Just put it on your neck and increase energy level up to the comfortable sensation. On the sliders and Modifix, you don't have to wait for the dose. It may take a long time, but if it doses fast, that's fine. For on the doves, I would suggest you wait for the dose. So with sliders and Modifix, just about 2-3 minutes on each side. But the secret is, try to make it high. Try to make the energy level high. If you don't feel it strong enough, that's okay, because it will still work. It's just easier and faster if the energy level is high. It will still be good. You do one side, you do the other side, and you do the point number 3, is the tailbone. So you stick it right into your pants and do the tailbone on the skin. Okay? So that's number 3. Why do we do tailbone? Because this is the 3rd point that can possibly access your parasympathetic nervous system, because it's a pelvic nervous plexus, comes out there, not the vagus nerve. Vagus is already, it's already gone inside, but there is a pelvic nervous plexus which is parasympathetic, which we want to influence as well. So 1, 2, 3 is a tailbone. The deeper down, the better, right on the skin, and you have to feel it. You have to feel it really pretty strong. So these are your 3 points, and this we call dove relaxation response, because it's gonna elicit your rest and digest response. It is the direct stimulation of parasympathetic nervous system, as much as you can do it. Now, if you're under little stress, you do it just a minute or 2 on each point, not a big deal. If you're under severe stress, you guys can keep it there for much longer. And I had a situation where I had to keep the dove on each side for 10 minutes. And it would doze a long time ago, but I would still keep it until I feel the change, until my headache disappears, until my mental clarity gets better, until I feel the result. On one point and the other, then on third, then you can do it again. There is no limit to how long or in which order you have to do the points. You can do the tailbone first, then move to the neck, doesn't matter. As long as you stimulate all 3 points. And what we didn't do, guys, we're supposed to take another self-assessment test after the dove relaxation response, which we didn't do. And now, because we had a break, the results are not valid. But you can do it at home at any point. But you get the idea. Now, in the book, you also saw other techniques there. That this is the simple version of dove relaxation response, which you can do anywhere, on the go, at home, at work, driving a car, basically at any point in your life, if you have your scanner with you, you can do that technique quickly, getting yourself out of stress, especially if you're in a stressful situation and you know it's going to affect you. So do it right on the spot. Now, if you have a little more time, you can do addition to that.